Welcome to the Dermastore podcast.
A chat about all things skincare, skin health.
And if you're a real skin nerd, we hope you'll join the conversation. Welcome to episode 21 of the Dermastore podcast. Hey Lara, how are you doing?
Morning, Greg. I'm fine. How are you?
Good. Feels strange not to be wearing headphones today.
I know, we're trying something different.
Yeah, getting some video in here. So it's a very important topic. We're tackling holiday melasma. So after the holidays, we've noticed quite a few people running around with darker marks on their face, which is typical.
Can definitely see who had a holiday in the sun, that's for sure.
So joining us in the podcast studio is Dr Webster again, our dermatologist. How are you, Dr. Webster?
I'm well, thank you.
Lara, what did you use this morning?
This morning, Greg, I used my Kiehl's, I can't remember the name. Okay. It's the clay exfoliating cleanser, the Rare Earth cleanser. Mm-hmm. I love the exfoliating polishing effect that it gives. Yeah. And then I used La Roche-Posay's vitamin C serum this morning. Okay. Yeah, 10%.
Nice.
Followed by ZO Skin Health Hydrating Cream. A really mixed bag of goodies today. And my faithful Color Science sunscreen. This week, actually, I've been testing the Heliocare 90, the Ultra 90 cream. Okay. And I've been testing it, but then I thought, it's definitely actually a winter product. It's very rich. And so I didn't use that this morning. And then I went back to Color Science. What did you use?
I used CeraVe Foaming Cleanser just in the shower. Dr. Barbara's Sturm Facial Scrub as well, which is lovely. CE Ferulic. And then I used an Arbutin 7% lotion, like a moisturizer that we're testing. Okay, yes. And then Marty D Active D. So love it. No surprises there. Okay. What did you use this morning, Dr. Webster?
The Nutrideca.
Okay, yes.
The Nutrideca for my seborrheic dermatitis. Okay. So that's my regular every morning.
My skincare, actually, Greg, I just wanted to say, doesn't stop at the humans in our household with Sean and I. Oh. It extends to our bulldogs. And I'll tell you why. The heat wave in Cape Town is so intense, and bulldogs are susceptible to heat rashes. Yeah. So thermal spring water out of the fridge on the bulldogs, it works like an absolute bomb.
Actually, you said that Sarah was using the Ven one in the office yesterday, under the fan, spraying it through the fan just to keep ourselves cool. I love that. And then Keenan asked, "Can I drink it?" I was like, "Well."
We have actually sprayed it before in our mouths.
It's just thermal spring water. So.
Thermal spring.
Alrighty, so jumping on to today's episode, as we mentioned in the build-up, melasma is a tricky condition, and you got to know the right way to treat it, the right way to tackle it. Obviously, it's brought on by changes in hormones and the sun. And what are the kind of pillars? And we've got 4 pillars, essentially, in terms of how we would approach treating melasma. Should we just start by identifying what it is and how to identify it?
Tends to occur in people with a darker skin tone, and what happens, you get darker patches usually on the cheeks, the forehead, and on the upper lip. That's a common area, and it's usually in women. Rarely men do get it, but it's almost always in women.
I mean, I see a lot of people with lighter skins also with melasma.
Yes, they can. Yes, they can. Yeah.
So I think it's more common in darker skins.
It's more common in darker skins, yeah.
I see a lot of young people who like the outdoors. Yeah, it's very prevalent, I think, especially in South Africa. So why is it tricky to treat? Why would we consider it tricky to treat?
Well, essentially, there's 3 sort of types of melasma. Okay. Number 1, you get what you call the epidermal melasma, where the pigment is just in the top layer of the skin. Yeah. So that often happens. A woman becomes pregnant, she gets a bit of pigmentation because she hasn't used sunscreen. After the baby's born, she uses the sunscreen regularly, and that pigmentation can disappear. So that epidermal form of melasma can sometimes disappear spontaneously. Most forms of melasma are what we call a combination. So in other words, it's a combination of epidermal with dermal.
Right.
So it's in the top layer as well as in the dermis. So often when I examine patients, just by looking at them, you can't say, unless you do a biopsy or use mole mapping or Visio, you can't say where the pigment is sitting. Yeah. So often when you start off the treatment, the epidermal form responds very nicely. So you'll often get an improvement, but where the pigment is sitting deep in the dermis, that is more stubborn.
Yeah.
And that's that dermal melasma, where it's sitting deep in the dermis, that is incredibly difficult to treat.
And one of the things that we have seen that main causes of melasma, so darker skin tone with more melanin in your skin, and then estrogen, or if you're taking estrogen-containing contraceptives,
Yes.
those two are the dominant.
Yes.
The constant is the sun.
Exactly.
So unfortunately,
Okay.
with your treatment, you'll see an improvement. But like you always say, as soon as you step into the sun, we're going to take step backwards.
Exactly.
So you've always got to have that in mind. That's the sun is the number one.
That is the
precursor.
common denominator.
Yeah.
And more now, visible light is we know visible light in darker skin tones
Yes.
can also, make melasma worse, pigmentation worse.
Yes.
Yeah.
Yes, so that's really cool. And I think what I wanted to share with everyone today is, although melasma is very difficult and tricky to treat, and it can be incredibly frustrating, that it is actually quite a simple, the steps to treating it is actually very simple. And so hopefully we're going to guide you on that today if you follow these 4 steps.
If you follow the advice. I think
Yes.
that's the tricky part, is that some people get really frustrated by it and they take sort of alternative therapy routes before actually seeking the real help, the
Yes.
professional help, and that often can make it worse. So yeah, that's why I think the purpose of this is very important, is that hopefully you can get out the starting gate as soon as you see it, you notice it. Addressing it earlier is the key. So the first pillar is really sun avoidance, wearing protective clothing, seeking the shade, and using sun protection.
No, I agree. And also I think education about prevention. So if you do have a darker skin tone and you are pregnant or you are taking an estrogen-containing contraception, realize you are more at risk.
Yeah.
So
Yeah.
prevention, use a proper sunscreen. People with darker skin tone are less likely to get skin cancer, but they're more likely to get melasma.
Can that melasma become permanent? It can drop into dermal,
It can,
and it can
yes,
be as
yeah.
stubborn as a lifetime
Sure.
pigmentation. Okay.
And I always say just one bad exposure to the sun, that can set you back years, sometimes.
Wow.
So obviously in the beginning it's usually epidermal, but if you nip it in the bud early, then it is treatable. Yeah.
Okay.
So the second pillar, I think, also talks to prevention. So using products that really can help preventatively if you're predisposed. I think just continually using products that contain ingredients that are well proven to help with pigmentation. So ingredients like azelaic acid, kojic acid, ascorbic acid, tranexamic acid, glutathione, soybean extract. Those are all ingredients that we know have proven abilities to help lighten pigmentation. And we mentioned the sunscreens, and you mentioned blue light. Mineral UV filters are obviously advised during pregnancy, but also having iron oxide is a key one as well. So that stops the visible light penetrating the skin. Specific products that we recommend on Dermastore for melasma, our antioxidants are super important. We know brands like SkinCeuticals, Martyderm, Abaji, Mesoesthetic, particularly the DSP Bright ampules with tranexamic acid, ascorbic acid, like we mentioned, Arbutin, we're always recommending. And then in terms of sunscreens, I don't know, what are you guys top of mind?
We definitely default to minerals.
Okay.
So our top of mind would be a Heliocare mineral tolerance, Color Science face shield, and we've recently launched Eyes Clinical's Eclipse. So those are mineral sunscreens. So those are our go-to, and they do have iron oxides in as well. And the reason why I think pillar 1, lifestyle, because that's every day, but onto that pillar 2 is I love skincare because it's a practice and a ritual that you do every single day. We've said it before, melasma, it doesn't sleep. The hormones don't take a break. So if we're using skincare every single day, we really are suppressing it as much as we can. In-clinic treatments and prescription products are important, and we can use them adjunctively. But I like to encourage a practice of every single day habits.
Totally.
So those
The
pillar
ritual
1 and
important.
pillar 1 and 2 are critical.
And then obviously pillar 3, it's got to that point where you need a prescription. And Dr. Webster, what do you recommend in your practice?
So hydroquinone is like still the gold standard.
Okay.
So Albert Kligman, the very famous dermatologist, he had the original Kligman formula, which was hydroquinone. It contained tretinoin as well as some cortisone. And that is still the gold standard. I personally use a modified Kligman's formula, so I find that tretinoin can be irritating, and I don't like using the cortisone, So I have my own we all have our own little secret little formulas. I have one that's more on an aqueous base with hydroquinone. I generally use either 4 or 5% hydroquinone. It works extremely well. It's cheap. So I give a prescription and they go to the pharmacy. I only use certain pharmacies, and it works like a bomb. Patients love it. The only thing is you can't use it too long.
Yeah.
It's got to
So
be.
how long does a patient use it
Again,
for?
it depends upon their skin type, but generally we don't want to use it longer than 6 months.
Okay, that's quite long, actually.
And then soon after that, you go onto your
Cosmeceuticals.
Okay.
But then often what I'll do is I'll wean them off. I won't stop them suddenly.
Okay.
Maybe use the hydroquinone once or twice a week and then introduce my cosmeceutical that's suitable for their skin type.
Yes.
Sometimes you might want to use a serum, sometimes you want to use a cream, and obviously different price points as well.
Exactly. So always look out for those key ingredients that we've mentioned.
Yeah.
And just to make a note here, because it's a very common question, is of course a pregnant lady who is experiencing melasma can't use
No, they
hydroquinone.
can't.
So that's where, again, the cosmeceuticals play such an important role. Dr. Webster, how does in-clinic treatments play a role with treating melasma?
They can help. Again, you've got to be extremely cautious, especially people with a darker skin tone. Unfortunately, there's a lot of clinics that will promise a sort of a magic bullet, So certainly chemical peels, mild chemical peels, medical microneedling can help, fractional laser can help. But I would say, in my experience, you've got to be extremely careful with that. Sometimes it can end up being worse.
Okay.
Yeah.
So, consultations, incredibly important.
Yeah.
And I think choosing the right modality for the concern is also really important.
So I have a skin therapist, a very experienced skin therapist in my practice, and she does those things. She does mild peels, she does the medical microneedling, she does the fractional laser. You will get some improvement.
Yes.
Yeah.
Okay.
But again, it's the ongoing treatment.
Yes.
Yeah.
It seems like a very stressful condition for a lot of people. I think because it's not easy. It can be easy depending on the severity. But I mean, how do you motivate your patients that it will get better? Obviously, you don't know depending on the severity. But what do you say to them when they have been going for a while and not responding?
So often that initial consultation is very important. You assess the patient, and if that patient often will come to me and say, "Doctor, I've had melasma for 10 years. I've seen 5 other dermatologists. I've seen skin therapists," then I know that is deep dermal melasma.
Yeah.
And this is going to be a chronic problem. And you've got to give them realistic expectations. Unfortunately, there's some clinics that will offer them this magic peel. It's all going to be gone.
Yeah.
And I see people that are very disappointed that actually end up being worse. So I think that initial consultation is so important. Realistic expectations. This is the deep dermal melasma. It's a chronic condition.
It's a long road.
It's a long road.
Yeah.
And they've got to realize that.
Yeah.
They've got to realize that. We will get improvement. I always say, when I prescribe that initial hydroquinone, I say, you're going to get an improvement. The degree of improvement is difficult to predict. Because when I look at the patient just from the clinical thing, I don't know exactly where that pigment is sitting. Most time it's a combination of epidermal with dermal. So initially that epidermal pigment will clear nicely, but that deep dermal pigment is going to be more stubborn.
So, realistic expectations, and I think patience, persistent
and
patience.
just managing your sun exposure very, very closely.
Very important.
And as Lara said, it's a daily routine. You've just got to.
Yeah.
It's like taking a blood pressure pill. You've got to. You've got to just realize you've got to do that stuff every day.
Yes.
And that sunscreen and all the lifestyle things are everyday thing.
Yes. And something that I also wanted to share that I think maybe a lot of people, women, it doesn't bother them.
Yeah.
Maybe the melasma mustache, for example, because they know that they're on the pill, or they know that they had a bit of sun in the holidays. But something that I just would like to bring to their attention is that it can get worse and it can become really, permanent almost. So let's just be aware of preventing that from happening.
Yes. And now, after the holiday season, we are seeing online and in my practice that a lot of people it is worse. Are struggling.
Yeah.
And that's just emphasizes the lifestyle things, because you have a beautiful summer holiday in South Africa, and you just got to be careful.
Yeah.
Still
Okay.
do the things you enjoy, but just be careful.
Definitely.
Yeah.
Right, I think that's all for today's episode. Thanks so much again for joining us. Take care out there, and we'll see you next time.
Cheers.
Cheers.
Bye. Don't forget to subscribe if you're keen to learn more about what we have to say. We would also really love your thoughts, ideas, and any questions you have for future episodes. You can email us on pod@dermastore.co.za.